Ladies and gentlemen, this is an article that came out on the Daily Mail, December 23rd, 2017. And West Virginia actually leads the nation in drug deaths, again, with 52 deaths per 100,000 people. West Virginia still leads the nation in the rate of drug overdose deaths, according to the latest data from the Center for Disease Control and Prevention, National Center for Health Statistics. The age-adjusted rate of drug overdose deaths in West Virginia was 52 per 100,000 in 2016, the Registered Herald reported. Ohio just edged ahead of New Hampshire in 2016, coming in second with a rate of 39.1 deaths per 100,000. New Hampshire dropped to third place with a rate of 39 drug overdose deaths per 100,000. The CDC said there were more than 63,600 drug overdose deaths in the U.S. in 2016. And ladies and gentlemen, that is based on only 22 states reporting their numbers. The other states did not report numbers to the CDC. That's where that 63,600 number comes from, 22 states. Overall, the age-adjusted rate of deaths grew 21% from 2015 to 2016, increasing from 16.3 per 100,000 in 2015 to 19.8 per 100,000 in 2016. Of those 63,600 drug overdose deaths in 2016, it was determined that the synthetic opioid fentanyl was linked to 19,400 deaths. The deadliest drug was determined to be the synthetic opioid fentanyl, which was linked to more than 19,400 deaths. The data indicated that drug overdose deaths connected to synthetic opioids doubled in just 12 months, growing from 3.1 deaths per 100,000 people in 2015 to 6.2 per 100,000 in 2016. In a press release, Joe Mancini advocated for a quadrupling of addiction prevention efforts, as well as increases in preventing overdose deaths and treatment opportunity. He also urged his fellow congressmen to pass his Lifeboat Act. The Lifeboat Act aimed to place 1 cent fee on every milligram of opioid produce, thus creating a permanent way to fund treatment centers. It's estimated that if the bill passes, it would collect about $2 billion a year in fees. All right. Despite my best efforts to work with congressional leadership and 2 administrations for nearly a decade, our country still cannot properly combat an epidemic that is ravishing our nation and that will change every aspect of our society for generations to come, Mancini said in the release. He said that it is now necessary to focus efforts on rehabilitation, in part to help people with substance abuse problems becoming a contributing member of society. For too long, we have focused on Band-Aid solutions as this crisis has compounded into many societal issues to count, he said. He's right, but personally, like I said before, I don't think they know quite how to take on this type of problem, being that it never happened before at this magnitude. We've had drug addictions, but not as big as this one and not as deadly. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe, and don't forget to hit on that notification bell. And also join me over on Black Junction. Please come over there, watch the videos, like the videos. Peace, family.